Check, check, 1, 2. Okay, hello one more time, dear ladies who are watching us now or just starting to watch us or rushing to your computers or mobile phones to join our second already live questions and answer session. And this time I'd like to introduce Dr. Mantas Sakalauskas, who will be answering your questions today during this live questions and answer session. And I would like to introduce myself as well. My name is Yurata, and maybe we have been in contact with you through emails or phone calls. And I'm really happy to start, I think. And before we start getting live questions here, in the comments, we can start maybe with some of the questions that have been already posted in our event. And also what I would like to mention, this time, as we of course are trying to improve a little, we hope that you will hear better sound, we'll see a better view, and because we have improved a little bit our location, and we have also some additional stuff which will be really helpful, I hope. And Mantas, are you ready for some questions? And can we start with what we have already?
Okay, firstly I want to say hello everybody. Yes, I am ready.
All right, so let's start then. We have been asked by some ladies in our comment section. For example, Miss Lorato was wondering, she is right now 8 weeks after the surgery, and she's asking if that's the right time for her to start going to gym. As we recommend for patients to wait for like 2 months, so 8 weeks. Good for everyone.
Going to a gym, it's very individual. You see, it depends on the surgery. If you had like breast augmentation or tummy tuck, so yeah, it's helpful to wait 2 months, because you see in tummy tuck surgery, what we do in most cases, we suture the muscle, so it needs time to heal, and 2 months it's enough. And yeah, after 2 months you can start to do exercises. After breast augmentation, also the implants, they are under the muscle, so we also need to wait 2 months when we can do exercises also for pectoral muscle. Like after the liposuction you can go after 3-4 weeks. If it is possible for you, if you don't feel the pain, you feel okay, you feel healthy, after 1 month or 3 weeks, you can go to the gym without a problem.
Mm-hmm. But for example, if I think that I feel very well and I go to the gym after 1 month, not after 2 months, and what are the cases when, for example, I have to understand that it's too early for me?
It's too early. I don't recommend to go 2 months after the breast augmentation or the tummy tuck surgery or the arm lift or the arm lift, yeah, or the tight lift. No, in any cases, or the buttock lift. In these cases, we need to wait more. Only when it is liposuction, yeah, then you can go after 3-4 weeks. Maybe you had also some eyebrow lift or upper eyelid surgery, so yeah, it's also safe to go after 3-4 weeks.
Okay.
But if you have a bigger surgery with bigger cuttings, it's better to wait 2 months.
Mm-hmm. Okay, all the time.
Yes.
No exceptions.
No. If you want good result, you need to wait, because
patience all the time.
You can done something wrong.
Mm-hmm.
The sutures can rupture, the implant can go in wrong position, so it's not too safe.
Yeah, you have to be careful.
Yes.
All right, Dr. Mantas. Miss Annette also was asking, she's writing, I'm very flat-chested and I want natural, bigger, firm bust. What recommendations on the best procedure would you give also what is the recovery time on returning to work after this kind of surgery? So very flat-chested, very, and she wants, natural and bigger look.
If it is very flat breast, you see, and you want natural look, what I recommend is drop shape implant, anatomic shape implant. But you see also, if you don't have the tissue, what can be the implant can be very visible. So maybe if you have some fat, maybe on the belly, maybe on the waist, maybe on the thighs, it's better also to do a liposuction and to do a fat transfer to the breast simultaneously with the breast augmentation with implant, when we can achieve the best result.
Okay. And I see that we still do not have live comments. So ladies, I really encourage you to just type anything what's in your head, and we hope that we will help you to put your minds at ease. And so, but still we have some questions posted before. And let's ask the question. Miss Shayla has asked, is transferring fat good to the butt and in your skin after eye bag surgery? Some doctors say that it is not, and it is not. It's a lot longer recovery. So we're talking about the fat transfer to the under.
It's only like lower eyelid surgery with only transfer of fat?
Yes, she's asking about transferring fat to the butt, but also to the eyelid under the lower eyelids. Yes. What about the transfer to the lower eyelids?
To the lower eyelids, in most cases, you see it was made very much procedures maybe 5-6 years ago, maybe 10. Now it's lesser because in some cases you see what you can have after the surgery, like sausage of the fat here in the lower eyelid. So now in most cases the best result what we can achieve, like transplantation, not like of the fat it's liposucted, just the fat cells, they are cutted, for example, from the belly and put here in the lower part of the eyelid to make the teardrop not so visible. In this case, this is better. So in most cases, I don't recommend to do the fat transfer to the lower eyelids. Just in some cases, what I need to do to remove the fat bags from the lower eyelid. And if we are talking about the fat transfer to the buttocks, what the question was about buttocks?
Is it good? Is it?
If it is good. What you need to understand that we can change the shape of the buttocks, but also, for example, if I liposuct 3 liters of the fat from the waist, the back, the waist, the belly, thighs, only around 2 liters of the fat I can put to the buttocks, because I need to wash it. After that it stays smaller amount of it, and also only around 50-55% for some patients. If they smoke, I don't recommend to do this procedure because it will not stay alive, the fat. But if it is okay, you are not smoker, you are good health, so around 50% of the fat that it's transferred to the buttocks stays alive. So maybe after the surgery, the buttocks will look very big, very round, but after 2-3 months, they will become smaller. You need to understand it. In most cases, what you see the pictures also, maybe on YouTube, maybe on Google, what it is, it's immediately after 2-3 days after the procedure. You must look when it is half a year, 1 year after the surgery, when you can see the real result. Yeah. So yes, liposuction, it gives a result. The waist, the belly becomes smaller, the thighs become smaller, but the buttocks, they are not the same as 2-3 days, 1 week after the surgery, they will become smaller. You need to understand it.
Okay. And here we are. We started getting live comments already.
All right.
And let's start with Mrs. Anil. She's asking, Doctor, how long after a tummy tuck and breast augmentation should you wait for the surgery, such as 360 liposuction with fat transfer?
Simultaneously the breast and the tummy tuck, or separately?
Well, I suppose she has in mind that she's maybe planning to have tummy tuck and breast augmentation at the same time, and after this kind of volume, she would like maybe to have another pretty big procedure. How long is the waiting time?
So you need to wait around 5-6 months, because you need to understand the tummy tuck surgery with the breast surgery, it's big surgery. So during the surgery also you lose Blood is also a big trauma for the body, so you need long time to recover. And also, for example, if you want, after the tummy tuck liposuction, what we need to do, we need to wait smallest amount of the time, around half a year, because you heal in the scars. All the humans, they heal in the scars, but not only the skin heal in the scars, also the deeper tissues, they also heal in the scars. So the scar 2, 3 months, 4 months, 5 months after the surgery, they are very hard. And it's very hard something to do it also. And also what you need to understand that some in the tissue that is operated, we damage the blood circulation in it. Yeah, there is like the term in neovascularization, so like the new vessels there are growing in the tissue. And this takes time. So if you try to make the surgery like earlier, 3, 4 months after the surgery, it's very big risk. Also the blood circulation in the operation area, after that we can have the problems. Not only with your general health, but also with local problems like necrosis. So it's better not to do it too early. Also because of big trauma for the body in general and also for the tissue that was operated.
Thank you, doctor. And another question. Ms. Hazel is asking, what is the difference between the Fleur de Lis and full tummy tuck?
Full tummy tuck or classical tummy tuck, it's only when the lower part of the belly is removed. So the skin that is hanging lower the belly button is removed. With a Fleur de Lis, in most cases, when I do a Fleur de Lis, then the patient had lost, for example, 40, 50 kilograms. And this happens also after the surgeries like bypass or something like that. So you must to lose very much of the weight. So what happens also, you have a lot of loose skin, not only in the lower part of the belly, but also in the upper part. So just removing the lower part cannot help. Then what can be, after the suturing, it stays very loose skin here all along the belly. So what I need to do also to cut like triangle shape of the skin and the fat in the upper part of the tummy. So after that, the scar stays all along from the chest wall going to the pubic area and horizontal scar like after the classical tummy tuck.
Thank you, Mantas. And Michelle is asking about pain medication. What type of pain medication do you send patients home with? So what do we give them?
What we give, when you are in the clinic, you get also narcotic painkillers and some stronger painkillers. When you go to the hotel, what we give is paracetamol and codeine. It's very good. Codeine is also a little bit like narcotic analgesic. It's not so strong, but it helps. Paracetamol also, and also what we give, diclofenac, to reduce swelling, inflammation, but also if you are taking diclofenac, you need to take omeprazole, because diclofenac, it irritates the stomach, so it can be some problems. So omeprazole, it reduces irritation of the stomach, and also what you need to do to take antibiotics in most cases after the surgery to reduce the risk of the infection.
Yeah. So we really try to help control the pain and manage the pain, because it is a very important part when healing, and for the psychological part as well, as the patient is, released from the clinic, and sometimes they may feel lonely or scared because it's painful, but
And also, after the surgery, it's hard to sleep. So in most cases, we also give the sleeping pills.
Yeah, and it's very good to have a good rest after this kind of procedure. And another question, Miss Alia is asking, can I ask, I'm having tummy tuck with Dr. Mantas in 2 weeks, she's asking. So you're coming soon, patient. And there are a lot of ladies, well, she says there are ladies who are getting seroma, and she's asking about drains. Can drains not be left longer than the 2 days in the clinic? So what is the drain politics in our clinic? Why do we leave them for 2 days and then take them out?
For 2 days, you see, it's like what we do, it's a practice that gain in time. So we just looked how it is after 2, after 3 days, after 4 days. And you see, in most cases, after 2 days, if you don't have the secretion, like more than 100 milliliters the 3rd day or 4th day, you will have no secretion from the drains. So it's enough 2 days for the drains. But in some cases, When it is, for example, from the drain, 400 milliliters, 300 milliliters of tissue fluid with some blood, so yeah, we leave for a little bit longer.
Yeah, so
But
it's not always 2 days and
no,
you
no, no,
are
no, it's
free
not
to
always.
go.
It's
Yeah,
not always. We need to look how the fluids were going from the drains. And because of this aroma also, yes, aroma, it can be in the belly, but what you need to do after the surgery to wear compression garment all the time, because the tissue must be compressed that the fluids they will not accumulate in these small like cavities between this flap of the skin and the fat and the muscle.
So not only the drains help to prevent seroma,
Yes,
but
of course.
also the compression
The
garment
compression
that the patient
garment
has
and
to wear.
also some soft massage after the surgery. So it's better to have it around one time during the day, around 2 weeks after the surgery. It helps to reduce also the swelling and the seroma risk.
Okay, thank you, doctor. And also, Simberlin is asking about, not about the surgery, but is there a possibility, for example, to change the surgeon when one patient wants to arrive for the revision correction procedure? And maybe I can answer this question, but yes, Simberlin, of course, it is possible to change, to pick the surgeon
Yes,
if you have any preferences. So it's just you have to tell that to the manager, and we will sort this out without any problems. And yes, there are also Leticia. Mantas is telling you, you were a very good doctor with me. Thanks for
Thank you very much.
a lot. Okay, let's go further. For the Mrs. Miriam is asking, for the lipo to flanks and back, does that include the sides, right up to underarms?
It's like armpits. No, the back and the waist is only what it is on the back. What you have here in the armpits, it's another zone for the liposuction.
So this is considered as another zone already. Okay, and let's go further. Mrs. Rianon is asking, how do you know if you have enough skin for a tummy tuck or a mini tummy tuck? If you only have a small amount of excess skin in is liposuction going to add to excess skin? So what about this, amount of skin and amount of fat?
When I can say if you need the full tummy tuck or the mini tummy tuck, it's only when I can touch you. But yeah, in most cases from the pictures you can see that you can do the full tummy tuck, but you need not like to know that the surgeon looked your picture and he said that it will be full tummy tuck or maybe mini tummy tuck. When you only arrive during the live consultation, when I can say exactly. Just now it is around maybe 70–80% that the surgery will be like that, as I said during the consultations from the photos. In live consultation I can say exactly what you need. Because sometimes, yeah, if you have like only excess of the skin in the lower part, maybe lower the belly button, and on the upper part the skin it's okay. It's flexible, it's not excessive, so maybe then, yeah, you need only a mini tummy tuck. But when I can see that the skin is too much, also in the upper part and in the lower part, yes, then full tummy tuck is needed.
Okay. Thank you, doctor. And also, Anil is asking, I've been in my garment all the time, only out to shower, and still I got seroma. Does this happen often when the garment with the garment, or could it be from not resting enough? That's a very good question.
Yes, of course, because you need to rest. If you move more, you need to understand that the swelling is bigger. The swelling is like the tissue fluid is between the cells of the tissue, the seroma, when it accumulates in the cavity. So if the swelling is bigger, it's very big tissue between the cells. So what happens with tissue, it cannot go to somewhere, it goes to this cavity and it accumulates here. So yes, the resting is a very important thing. Because of that, we recommend from the work, you see if it is not physical active, if it was physical hard, you need to rest also around 3–4 weeks. If it is physical hard, you need to wait 6 weeks, 7 weeks, because this is the risk for the seroma also. If you are not resting, if you are moving too much, then the swelling is bigger and the risk of the seroma is also bigger.
And is the risk reducing with time? For example, if I feel okay. I had this kind of big surgery, and like after 2 weeks, I go and move, and I go shopping, and I carry things. Is it a bigger risk for the seroma to appear then?
Of course, because seroma, it can appear around 1 month after the surgery.
Around 1 month, you have to be careful all the time.
Yes.
Okay, thanks a lot. And also, we just also got a question which was written in Swedish language, and I have asked my colleagues to translate the question, so while they are working on that, we'll continue with other questions, okay? So, Mrs. Terrace is asking, she's writing, I wonder if you have experience in operating patients with Ehlers-Danlos syndrome.
Sorry, I didn't have.
You do not have experience in operating this.
No, I didn't have the patients with this syndrome.
Okay. And Mrs. Katie is asking, what would I expect the scars from Offlift and implants to look like 3-4 months afterwards? So, breast uplift with implants.
What the scars can be,
3-4 months after the surgery, how would the scars look like?
So the scars, they depends. It depends if you're smoking, if you're not smoking. Also, what depends on the size of the implant. If it is a smaller implant, the tension of the tissue is smaller. If it is a bigger implant, the tension of the tissue is bigger. The risk of a bigger scar is also higher. So in general, after 4 months,
3-4 months.
3-4 months. The scar, how it looks, if you're healing okay, it will be like red lines around the nipple vertical and under the breast. But if there is some problems, like maybe also it's very individual, some patients you see they heal in bigger scar, but there is no tension. But it's also like individual feature of your body, how you heal. It can be like hypertrophic scar, keloid scar, but it's also rare condition. Most of the cases you heal all right, so after 4 or 5 months, what will be small red lines around the nipple vertical and under the breast. And also what I recommend to do when it around 1 month after the surgery to start to put special silicone gel or plaster on the incision site.
It helps form the scars.
Yes, it helps to reduce hypertrophic scar formation.
And also about the exposure to sun.
Around 1 year, you must not be under the sun exposure because the scar can become bigger, yes.
Bigger and maybe also darker
and red and darker and bigger and painful, yes.
So yeah, you ladies have to be careful when wearing bikini right after the surgery on the beach. All right. So we have a translation, and Mrs. Michaela, she was asking, Mante, you have performed her surgery 3 weeks ago, and her belly button is a bit yellowish right now. And why it is so? What should she do?
If yellowish belly button, you see belly button, it's a little bit more complicated part in the tummy tuck surgery because it's deeper. Some fluids will also go down here, maybe they stay a little bit too long. And in most cases, this yellow one or the white one, think it's fibrin called protein. So it's sometimes normal fibrin during the healing. So in these cases, you see what you need to do. You need to put like some dressings with fluids like betadine or something like that to make it less wet. It must be not wet, the belly button, then it will heal faster.
Okay, and also she's adding, I'm also thinking that down from belly button, there are some stretches which became, which she has scabs now on.
Yeah, it's darker because this part, the lowest part, it have bad blood circulation. Because you need to understand the blood circulation, blood supply comes from the blood vessels. They are stayed like over the rib cage and here from the sides. So this part in the middle, it has the worst blood circulation. And yeah, after the cutting the belly button also, sometimes we cut also the blood vessels when we cut the hole for belly button, so it also reduces blood circulation to this part. So in some cases, some superficial damage of the skin it will be. But this scratch, it must go off. After that, what you will have like red lines that after 3-4 months, we will see be around the same color as the skin, as the surrounding skin. Yeah. She's not the first. For some lady, yeah, this happens.
All right.
Yeah.
Thank you, doctor. And okay, Miss Brenda is asking, what is the maximum age when people have tummy tuck and liposuction? Maximum age. Are
Maximum
there any
age.
age limits?
I had a patient that is 75 years for tummy tuck, so there is no limit if your health is okay. But yeah, you need to understand that if you have some problem with the health, some issue problems, so the doctor anesthesiologist also, he do the consultation before the surgery, and if we see if it is too much problem with the health, it is too risky, so then we will not to do the surgery. But yeah, we know also before you coming here, because we ask to fill some questionnaire about your health.
Yeah.
So we know if you have too big problems for the surgery.
Thank you. And okay, Simberlin is asking again. She's right now 5 months. She's writing, at 5 months post-surgery, tummy tuck should change significantly later on after, right now it's 5 months, and in 6 months, 7 the
swelling will be lesser, the lower part, it will become softer, because 5 months after the surgery, it's still hard.
Okay.
The scar is also still hard. It's red. You have no sensation in the lower part of the belly. Yeah. This happens after 8-9 months. It will be different. More sensation, softer scar, and also more comfortable in the lower part of the belly.
Okay, so 5 months is not still
not the limit. The swelling, it can be 5 months.
And also, and she's asking if the revision offered can the revision be offered at this stage? 5 months is too
early. It's too early because, how I said, during the surgery, what happens after the, for example, after the tummy tuck surgery, like we dissect all the skin and the fat, all of belly, skin and the fat, all the way to the rib cage. So it's like blood circulation, how I said, goes only from the upper part. So all this part is without the blood vessels. So during this time also be done with the organisms, what the tissue does. How I said, new blood vessels must ingrow in the tissue.
It takes time,
in the tissue. So if you try to do a surgery 3-4 months, maybe 5 months, like in your case after the surgery, it's too big risk for necrosis.
Okay.
It's too big risk, and for bad healing and the big complication like necrosis, it's too big risk for it. Because of that, we don't do the surgery 4 months, 5 months after the surgery, because of high risk of complication, and also the tissue, it's not soft. Because how I said, not only the skin heal in the scar, also like deeper tissues heal in the scar.
Yeah.
So the scars also, they are between this flap of the fat and the skin to the muscle, not only here superficial.
Yes.
Need to wait until it will be safe to do the corrective surgery.
So revision is always, we say to our patient, that's waiting
revision,
6 months.
Quick revision, you see when it must be done, maybe if you have big infection like you are with the implant after the breast augmentation. If you have like big necrotic infection, when you need to remove this dead tissue, when we need to do it quick. But if it is problem...
If it is healing, for example, still healing, and you want a correction...
Yes. You need to heal entirely, and the tissue, it must become soft, and the blood circulation also must become good.
Okay, so that's why 6 months is the earliest.
It's not the limit, it's not the limit. Also, we agree to do it 6 months after the surgery, because the patient, she or he wants to do it quicker, but safer way to do it also after 9 months. The safest after 1 year, but in not all cases we can wait this amount of the time.
Okay. So going further, another question. Katie is asking. I asked this question to the group, but just wanted your opinion. I have had 5 children. Congratulations. may have another in the future, but desperately need a tummy tuck right now already. Would I be best waiting till I've stopped having babies?
I think yes. Because you need to understand, if you do a tummy tuck surgery right now, the result, it can be great. But during the pregnancy, what happens? The belly becomes big, it becomes round, the muscles were stretched because also of the hormones amount in the body. during the pregnancy, so it becomes soft, it becomes round, the skin also becomes stretched, and after the pregnancy, in most cases, it don't go back. So after the pregnancy, if you had the tummy tuck surgery, the result will be not fine. So it's better to wait until you will have all the babies as you want. Then I recommend to do a tummy tuck surgery for the best result.
Okay. And Mrs. Anil asking again, is there anything that can be done at home when a patient comes back home already after the surgery in order to prevent seroma or to reduce the risk of seroma? So add more compression to the area, for example, or I don't know, go to special massages?
Compression, I think it's enough what we give the compression
Okay.
suits. But also massages, it's very good. Very good for reducing the seroma and the swelling. So yeah, to prevent seroma and swelling. So it's better to go to some soft massage, but not too much. Around 2 weeks after the surgery, I recommend to do it when the risk here is also much smaller and you need to rest. Yeah,
not to carry anything heavy?
No, not to carry anything heavy. Around 1 month, not more than 5 kilos, what you can carry. If you carry more, if you walk more, the swelling becomes bigger in the lower part, and how I said, the tissue fluid, it can go also in the cavity and to formate seroma. So you need to rest.
Yes, ladies, you have to spoil yourself till the maximum after the surgery.
Yes.
Okay, and Camilla is asking, after the surgery, tummy tuck and breast lift, is it good to wait to take a shower for like 2 weeks? Because some clinics says 2 weeks and some says a few days. What is our politics here?
Our politics is to clean the incision sites faster. So, for example, after this big surgery, around 3 days after the surgery, it's safe to go to the shower. What we put special tapes and some other upper plasters, brown plasters on the incision sites to cover them. So you can go safe with these plasters to a shower 3 days after the surgery, and you must do it, because if you don't go to the shower, you see what can be, the bacteria can be accumulation around the incision sites, and then the infection risk is becoming higher. So you need to go to a shower 3-4 days after the surgery. But in some cases, what you need to do, you need help from another person, because if you take off a compression garment, the bra, also in most cases you can become dizzy. So it's better with someone help to go to the shower and maybe more in the sitting position.
So but that's only for the very few first days after the surgery.
First days, like you're going the first or second time to the shower. After that, you become stronger. You can do it by yourself.
Okay. All right, Mantas. Another patient, another our listener, Rhiannon is asking, if I only have a small amount of excess skin and you're not able, to perform full tummy tuck, would liposuction make this excess skin worse?
Liposuction, it can make excess skin worse. You see, if your skin is thin, it's very elastic, very loose, the liposuction won't help here. You see the loose skin, how we can treat only by removing it and suturing the gap between the skin. When the skin is sutured in some tension and when it becomes good shape, the loose skin with liposuction we cannot treat.
Okay. And another patient is I always call ladies patients. That's my habit from working a lot. So Miss Ida is asking, I will do a total of 3 surgeries, and she's going to have tummy tuck, breast lift, and eyelid surgery. Would it be better to do them all in one visit, or should she wait?
These 3 zones, they can be done in one time. But, for example, if you have the tummy tuck, the breast lift, and the arm lift, then the risk of healing problems it becomes much higher. Much higher because of the losing also of more blood. The longer incision, the bigger risk of the infection, also the bigger risk of bad blood circulation in the operation area. But with the eyelids, it's safe, because the eyelids, it's not big surgery, it's only the upper eyelid, so the site is small, and you will not lose some big amount of the blood. So it's safe to do in one cases the tummy tuck, the breast lift, and the upper eyelids surgery. It can be done without problem. In some cases, we do also the upper brow lift in the same with surgeries.
Okay. And another question from Mrs. Gary, and she's asking about liposuction under chin area. How is it the laser liposuction or the regular liposuction? What is the technique which we apply when we perform the liposuction on this area?
What I did earlier, I did also with laser, with liposuction with laser, but I don't see the differences because between this classical liposuction and laser liposuction. And with laser liposuction, it's also much more higher risk to make the skin burn. Like burn wounds, and after that it heals in very bad scars. So it's safer to do in the classical liposuction because the results are the same. Have loose skin here in the lower part, in the chin, you will not have the result. If you have only the fat accumulation, the result it can be good, but if you have excess of the skin, in most cases you need the facelift.
Okay. And another question, Miss Christina is asking, how much does it cost for the breast lift with implants and 4 areas of liposuction at the same surgery? So, Ms. Christine, we usually ask our patients to send us pictures for evaluation first, and then we give an individual estimated price for the total combination, and we will contact you. I suppose we can chat in our Facebook, or you can email us directly, and we'll find out your personal quote then. So, and one more question by Ida. She's asking about the eyelid surgery, and she's writing, I will remove skin on the eyelids. Are you awake for this procedure? That's what I have read. And if so, what measurements are taken to calm the patient? But
it's only the upper eyelid surgery? It's combined surgery?
She's not asking actually, but maybe we can talk about
in
upper
some
eyelid,
cases, the upper eyelid it can be made in the local anesthesia. If you are not afraid of the needle, if it is okay for you that you will hear the medical personnel around you, but also you will feel some stretching, some maybe strange feelings during the surgery. And what was the question?
The question was, is the patient awake for the procedure?
Yeah, so it's possible to do when you are awake. But in most cases, I recommend to have your anesthesia when it's better for you and it's better for the doctor. Because when you are awake, all time I need to ask you if it is not painful. I must to make it very slowly and careful. It takes also time, and in some cases you feel also the pain.
Oh, even though.
Yeah, because
like that.
During the upper eyelid also what I need to do not only to remove excess of the skin from the upper eyelid, but in most cases to remove some fat pads. And they are deeper, and it's too risky to put the needle also so deep. So in some cases when we are pulling the fat, it's very uncomfortable feeling. So it's not fine. In most cases I recommend also general anesthesia for the surgery. Yeah, it can be made in the local, but it's better to do it in general. And
if we make it under local anesthesia, still we put some medications on the patient.
Yes, of course, to make you calm. Calmer, yeah, we do like maybe the Midocalm, it's called, the drug, to reduce, to make you more calm.
Yeah, simply.
Not so nervous.
Okay, thank you. And Simberlin again is asking, does the returning patient get discounts on further surgery? Yes, of course. We offer our returning patients 10% discount for their surgery, for their second surgery, for their third surgery. So we're always inviting them to come back and to go further for their dreams with us. And also one more question by Alison. Can you tell me the pros and cons of having drainless tummy tuck or having the tummy tuck with the drains? So pros and cons of the drainless tummy tuck without the drains, and of the regular tummy tuck when we leave the drains. What?
Without the drains, in my opinion, is high risk for the seroma without the drains. And with the drains, yeah, it's lesser. But in most cases, what we do, it's also like progressive tension suture technique. So what we do, we suture also the flap of the skin and the fat all the way to the muscle, not only here in the lower part, but also all here. So some doctors, they prefer no drains. I prefer the drains because in my opinion, it's safer. Because some secretion, some fluids, they can accumulate in all cases during the surgery. So yeah, if your body, it's very individual. Some patients, you can have like 200 milliliters of a fluid in your belly in 1 week, and in the second week you have none. But some, if you have, it don't resorb, it stays there. So, in my opinion, it's safer to leave the drain, but yeah, it's the doctor opinion. Maybe another will say that, in his opinion, without the drains is much better. But just I'm telling in my opinion what it is.
Okay, thank you, doctor. And Ms. Terrace is writing, I have lost 60 kilos and I did a tummy tuck under the belly button. And now my lower part of my stomach is flat and skin over the belly button is loose. Is it possible to do an operation to remove the skin over the belly button? So it's kind of, I suppose it's like second stage of the...
I understood. So how I said when I do the Fleur de Lis, I think after the amount of lost the weight for the patient, it was done what must be done with Fleur de Lis. So now you had the classical abdominoplasty. So yeah, this upper part, excessive skin, it can be removed, but after that you will have a vertical scar all the way from the chest wall to the pubic area. But yeah, it can be removed.
So the patient, this patient can simply have the second
course,
round of the surgery and actually fix this.
It can be done. Yeah, the drawing is simple. Just I don't remove the lower part of the skin, just here in the middle of the belly.
Okay. And Mrs. Fiona is writing, I'm going to have a breast lift and implants. I have very strong pectoral muscles because I do climbing and circus tricks. A very sporty woman. I don't want to permanently lose my upper body strength after I've completely healed. I know I need to wait about 8 weeks to train again. So would dual plane placement still be best for me, or would subglandular be better in my case? I have a good amount of breast tissue of my own.
If you want small size implants around maybe 200, 250 milliliters, yeah, it's safe to put also under the gland, always, so over the muscle. If you want the bigger ones, so it's better to put it under the muscle. And you see, if you have like dual plane technique for the breast augmentation, you will not lose some straight of the pectoral muscle, because what I do under the muscle is dual. That, yeah, we need to wait 2 months, and we start to do exercises, and we have their strength. They don't lose the strength. So it's safe to put it under the muscle.
Okay, thank you. All right, another listener is asking, Miss Aliyah, I have laughed lines on my face. I don't want fillers. Is there anything else permanently to make the lines look fuller? Well, to make
so then what can I suggest to do the fat transfer to the face? Then we can achieve here, you see, to fill what it's lost during the time, to fill the amount of the fat that you have lost in your face. And yeah, the fillers, they stay around 9 months, 12 months in the best way. And the fat, they stay longer. But it's also not like permanent for all time of your life. Around 6, 8 years, 10 years, it can be. But also with the fat, what you need to know, if you gain weight, the fat that was transferred to the face, it also becomes bigger, so your face also becomes bigger.
Okay.
So it's normal fat cells, they can grow also bigger if you gain the weight. But yeah, for this problem, the fat transfer, it can be done.
Thank you. And Mrs. Tonya is asking again, there is a question about the compression garment, because she says that it's a very different opinion by surgeons, how long you have to wear this compression garment. And when is it okay, for example, to take it off at night after a few weeks, or what is the period when you really have to be cautious about that?
What I recommend is 2 months. But it's also, it's very individual what you have as swelling. Some patients, they are less swollen than others. So if you are less swollen, you can wear it 1 month, 1 month and a half. If it is not comfortable for you, you can take it off during the night. But if the swelling is bigger, it's much more safer to wear it 2 months when you will feel better, and the result will be better. So in general, 2 months you need to wear it. Maybe if you have very little swelling, so 1 month and a half, 1 month, it can be safe. But what I recommend to wear 2 months, it's better. Some patients after 2 months, we don't want to take it off. We wear it 3-4 months because it's more comfortable, and if they want, we can do it. It's not a problem.
Okay, thank you, Mantas. And Netlex is asking, can I have your thought on a 360 tummy tuck, please? So, Dr. Mantas, could you say what's your opinion about this 360 circumferential tummy tuck surgery?
In my opinion, in most cases, when you lose the weight, so the excess of the skin is not only in the belly area, it's also in the back, in the armpits, on the arms, on the thighs. But yeah, this circumferential tummy tuck, it's when we remove all the excess of the skin all around the waist and from the belly. So in some cases, I recommend also to do it. But when you have also very excess of the skin in the upper part of the belly, yeah, it can be done fleur-de-lis with also removing of the excess of the skin in the back. So what I think about the surgery, that you are circumferential cutted. So it's painful because when you stretch, one side is stretched, when you stretch another side is stretched. So it's not so comfortable, but during one time you can achieve like big difference. So yeah, the result of a surgery, it can be good. So in most cases, yeah, I recommend to do it. Maybe the patient want to see the breast and the belly. So in these cases, what I recommend, maybe fleur-de-lis abdominoplasty and the breast. But if you want improvement in the back and the belly, so yeah, in most cases we can do a circumferential abdominoplasty.
And the difference will be really huge, and
yes, of course, but
the results
because
should be
the big amount of the skin is removed. When it's not hanging, the shape becomes very good of the waist and the belly.
Okay. And we have one more question by Miss Paula. She is writing, if you choose to have a fat transplant procedure to the breast, can you choose which areas to have the fat removed from? So, you know, it's kind of still two surgeries, this is liposuction and fat transfer. So can the patient, well, show you, doctor, could you please do the liposuction from here?
So like for the simple,
how do you decide the area?
like for the simple liposuction, if you have some problems with some areas, we can do a liposuction of this part, and what we get the fat, we can put to the breast. If you are coming and you are saying, I only want fat transfer to the breast, then I can say, yeah, the belly fat is the best, let's do the liposuction of the belly area. In most cases, the belly is the area for the liposuction. To do the fat transfer, because the fat is the best from that area.
Best quality fat on the belly.
Yes.
Okay.
Yes.
But still, you discuss the areas
yes,
with the
of
patient
course,
prior the
if
surgery.
you want some improvement in some areas, it can be done without a problem.
All right. So, and same goes when we are talking about the Brazilian buttock
Yes,
lift,
of
I
course.
suppose.
For the Brazilian, I recommend to do the liposuction of the belly, the waist, some upper part of the back, the thighs, when we also can achieve a better result, because we improve the shape not only in the buttocks, but also in the belly, in the waist, in the thighs.
Okay. So it's a very good, well, fat transfer is
it's a good procedure because we can like two
improve
goals.
Two goals, You reduce somewhere where you want to be reduced, and you enlarge somewhere you would like to be a little bit rounder. So it's a very good thing, I guess. And doctor, we also have some questions from the comments before we started the session. And there is one When can you start doing the AB work after the tummy tuck with the muscle repair?
With the muscle
because
repair.
yeah, one lady Sarah named Sarah, she wrote that she's tried recently at 3 months post surgery, but she's actually a little bit scared. So, are there any sensations that you have to be aware of when you're having this? Training your tummy, because it's good to train your tummy after the...
It's good to train tummy. It's good to train tummy after the tummy tuck surgery, because in most cases, we do a muscle application. When we don't do a muscle application, maybe only for the man, they have a stronger muscle. But in women, in most cases, we have the gap between the muscles, so we need to do the muscle repair. And you see, when I suture the muscle also, I don't make them stronger. I just remove the gap between the muscles. So we are not becoming stronger. We are just without the gap between them. So if you want that the belly will stay in flat way, it will be good shape of the belly. After 2 months, I recommend for all patients to do exercises. You need to start to do exercises. Maybe you will be stiff, it will be painful, uncomfortable, but slowly you need to start to do it. And when it is 3 months around the surgery, in most cases, the patient we can do in maximum strength. Because the stitches we are suturing, we are holding, we are still here. They disappear. Some stitches will disappear, some none, but they stay in the muscle and we are holding the muscle. And the scar also becoming formated, it's hard, it's holding the muscle, so you can start safely do the exercises. They will not separate again. The scar and the suture will hold the muscles. And when you do the exercises, the muscle becomes stronger, the belly also becomes flatter. The result becomes better.
Better.
Yes.
And you can still work on improving the result constantly.
Of course.
Yeah.
Of course.
So that's, not only the surgeon who has to try for that, but also the patient as well. Okay, we have a question by Emma, and she's writing, after the Brazilian buttock lift, my back isn't so nice. Some places is not fat, so it didn't look nice. What to do? Do I need to take another Brazilian buttock lift? And well, she's a little bit upset right now about that. Maybe the result has changed after the fat transfer and with time.
I don't know what time it's now after the surgery.
It depends. And okay, we do not know.
It depends. If it is, you see, only 1 month, 2 months after the surgery, so it's not the result. For the result, for the buttock, fat transfer to the buttock, we need to wait around also 5-6 months. When we can say that, this is the liposuction result, this is the fat transfer result. And if there is some now irregularity, so it can be also the swelling. Maybe also it can be some small hematomas. We are healing, we are resorbing. So I cannot just say now exactly what it is.
And what if we are talking about 6 months period usually, so you have to wait at least
for the
6
liposuction,
months.
yes, it's enough.
But for the Brazilian buttock lift, is the final result after the 6 months, or you can
around like that, because what you need to understand, the amount of the fat, maybe it will become smaller faster. How is it? Because only 50% of it stays alive. But also what can be, in some places, it can be hard. It's also healing. It also, the scars also we formate in the buttock after the fat transfer, because with what we put the fat to the buttock with the cannula. Cannula is metal thing, it also hurts the tissue. So it also stays the scar, so in most cases some areas can stay harder, also around 5-6 months. So because of that reason, I cannot just say after 2-3 months, 4 months, that it will look like the same, like after 6
immediately
or
after.
more.
But doctor, if a patient still, it's okay, well, the situation is like this, the fat didn't survive, and you have the smaller, what you have expected. Is it okay to have another one?
Of course, if you have some fat that can be
that can be transferred,
yes,
you still can come back and to once again try and start. And after 6 months after the initial surgery, or
it's better to wait more, because
Okay.
the scars they also too hard. And what can be, you see, I cannot to liposuct as much as I want the fat from the liposucted areas, because they are too hard to liposuct. You do the liposuction and the fat cannot go out. Because the scar is hard, it's holding the fat cells, they are not going out. If the scar is softer, then you can go through it with the cannula and you can do the liposuction in that part that was liposucted before. So it's better to wait until it will become softer when we can
Okay.
achieve a better result.
Okay.
In most cases, you need to be patient.
Yeah.
Yeah, I understand that all we
Yeah.
want, like quick changes.
Of course, it's,
Yeah,
you
one
know,
day
you're
like
going
that, the
for that,
second
you're
like
dreaming
that.
about
But you
that.
need to understand that it's
It
human
is.
tissue.
Yeah.
It's healing, it needs time. Most of the things must be through the healing process. It's
Yeah.
long process, so we need to wait.
But the good news is that it can still be improved in the future.
Yes, of course.
Yeah. Okay. Good. Thank you. Another question. Mrs. Sharon, she's asking, can you have a lot of liposuction if you're having a tummy tuck with breast augmentation and back, underarm, waist, like you're having this kind of big surgery already, right? It's tummy tuck and breast augmentation, but can you have liposuction also on back, underarm, waist, and flanks? Can it be combined in
It
any
can be,
way?
but what we need to know before the surgery are also what we do the blood tests. If your hemoglobin, what means hemoglobin, it carries the oxygen in the blood system to the cells. So if you have good amount of this hemoglobin, yeah, we can do the bigger surgery. But also what you need to understand that it must be not more than 5% of your body mass. If you, for example, weight 70 kilos, so 3.5 liters, 3.5 liters of the fat, it can be liposucted, not more. If it is more, then it's becoming risk of losing too much blood. When it's becoming bad for your own health, what you can be needed, also blood transfusion, it's also not fine. The healing can be worse, the infection risk is much higher, so it's better to do it in safe way. Yeah, if you have not big amounts of the fat in the waist, in the back, in the tights, outer tights or inner tights, it can be done in all the time with the breast and the tummy tuck surgery. But if it is too much, we need to think about your own safety.
Yeah.
Firstly, the safety, then let's try to think what amount of a surgery we can do.
Okay, thank you, doctor. And we are almost going to an end, but still have some questions. And there was one question in Norwegian from Josephine, but my colleagues have already translated that. And here it is, doctor. Josephine is writing, I did tummy tuck and breast lift 2 years ago, and but I do have big, thick keloidic scars, which are painful. And could you please help me? She used to apply creams for scars 6 months after the surgery, but it seems like it didn't help. So what can she do right now about that?
When you have keloidic scar, what helps the best is this canalock injections. It's triamcinolone hormone. It reduces inflammation in the scar, and the scars they then becoming softer. Yeah, they don't become smaller, but they becoming softer and not painful, you see. And when the scar is not painful, it's soft, then in most cases we can remove it and to suture again. But if they are now active, it's very high risk also. If I cut them, they can heal in the same way. So what I recommend now is this triamcinolone injections, this hormone. It helps in the most cases, yes.
Okay.
Also, and the silicone plasters, the lady put that.
Well, she said that she used to apply the cream for scars.
The cream. So
So
maybe also she can try the silicone plaster.
Although, even though it's 2 years already after.
Yes. Because silicone, it reduces also inflammation in the scar.
Okay, thank you, doctor. And still, while we are, I think that we will finish soon, but still, as a couple of minutes left, I'll give a question from the comments that were posted before we started this live session. Mrs. Fiona, she wrote us. She's writing, I'm hoping to book in soon for breast lift and implants. I have a good amount of my own breast tissue and my nipples aren't very low, but I have a fair bit of glandular ptosis from breastfeeding and weight loss. I've been advised to have a lift and implant through the nipple and a round high-profile implant in dual plane position. And I'm wondering if you could give me an advice. I do a load of aerial arts, mainly silks, and I have very strong pectoral muscles I've heard that if you go behind the muscle, that it might deform the shape of the implant. Is this true? And finally, what implants might be best for me? I want as natural a feel and movement as possible, and big enough to make me full looking, but not so heavy. They will get in the way of my exercise.
So if you're talking like changing the implant form of the muscle, you don't change the implant form, because what we do, we don't put like just dissect very little the muscle and put the implant inside it. No, we need to dissect correctly the muscle, that it's no tension, that it will be in good position under the muscle, so when the muscle move, it stretch a little bit the implant, but it's not change the shape of the breast. It's not changing. It's a safe way to put under the muscle. The shape, it stays the same. And now you see, if we are talking about the implants, now what we put Motiva implants. They're very soft, nice in touch, and the surface also is very soft. It's very little risk of capsular contracture.
Okay.
So in most cases, this implant is the best.
Okay, doctor. And one more question by Miss Tracy. She's writing that. She's writing that she's very lucky to have Dr. Mantas for her surgery on the 5th of December. So can't wait for that. But her question is about the stitches. Do you use dissolvable ones?
Yes. Earlier I used not dissolvable, but now I use dissolvable because it's more comfortable for the patients.
Yeah.
Because some patients, they had the problems. The problems with the stitches, we were not removed correctly. So for now, I put dissolvable stitches. Just in most cases, what you need to do to cut small nuts, where are in both sides of the incision site, and that's it. And the suture disappears 3-4 weeks after the surgery, and it's enough time to heal the wound.
Yeah, so we, in general, in clinic, we all use these kind of dissolvable stitches for past few months, and it's a very good practice. As we see, it's really comfortable for our patients. This is okay. And one of the last questions, while we're also almost in the end. One patient, Tracy, she's telling that she's coming for implant removal and replacement, and she had implants in for 20 years, and they are over the muscle. Will I still be able to have them over the muscle again? Also, if you found they have ruptured, will there be any complications like in surgery due to a rupture?
It's better to put them under the muscle, because if you had 20 years them over the muscle, I think they go down with the breast also a little bit. So in best cases, to put it under the muscle and to put it a little bit different shape. In most cases, what I do when I change the implant that is over the muscle, I put anatomical extra high profile implant that stretches also the lower part of the breast. When the shape is better, but I put also under the muscle, but it's dual plane technique, so it's half under the muscle. 2/3 of the implant is under the muscle and 1/3 is lower the muscle.
Okay.
And if about the ruptured implant,
Yes,
it was asked also, if I found the ruptured implant, it's not like bigger risk. Just, what I need to do, maybe if it is some silicone in the pocket, I need to wash it very well and to remove the old capsule. Then it's safe to put the new one implant, and it's not higher risk of a complication.
Okay. And we're really almost in the end, but one more question we will answer, I think.
Of course.
Doctor, Ms. Rainon is asking, last question for me, okay, for you. If you believe you have a muscle separation, but the surgeon believes you do not need a tummy tuck for excess skin, will they still perform the tummy tuck to repair the muscles?
Only repairing of the muscles?
Yes.
It can be done, but the incision, it must be done like in the mini tuck surgery.
So it's kind of not the full tummy tuck then, but the mini tummy tuck.
Without removing the skin, it can be done also. But it also can be done like mini tummy tuck incision, but also incision must be made around the belly button. Because we need to dissect all the way to the rib cage to see this gap between the muscles. It's not so comfortable to suture the muscles, but it can be done. Yeah, but then the scar also stays around the belly button and around 15 centimeters here in the lower part of the pubic area.
Okay. So I think this is about that. I really would like to thank you all for your questions, and all the questions that we may have missed will still be answered in our comment section, I suppose tomorrow. And thank you, Dr. Mantas, for your time and for your honest replies. So, and I believe that we will meet you soon in our third live session.
Thank you for watching us.
Thank you.
Bye-bye.